I'm Charles Bankhead of MedPage Today, reporting from the Combined European Cancer Congress in Stockholm. Women with early-stage breast cancer had a 35% lower risk of recurrence when they were treated with synchronous rather than sequential chemoradiation. Synchronous therapy did not adversely affect survival or quality of life, and women liked it, according to Dr. Indrajit Fernando of the University of Birmingham in England.
An alternative way of trying to manipulate sequencing is to actually take your radiotherapy and not give it at the end, which is what most people in the world will actually do at the moment, but to bring the radiotherapy and bring it much earlier and try and what we call either sandwich or give it in a synchronous manner. And this, of course, means that you avoid the delay of the radiotherapy. It means that potentially you shorten the patient's treatment time, and also giving it together in this manner, there might actually be a synchronous effect, an effect of the two treatments that might make local control better than giving chemotherapy followed by radiotherapy, which is the standard treatment.
Aside from the sequence of therapy, the patients were all treated in the same manner.
Patients with early-stage breast cancer, suitable for either wide local excision or mastectomy, fit for treatment, and they had to have a complete macroscopic removal of the tumor, and patients could be given either a CMF-type chemotherapy or an anthracycline followed by CMF chemotherapy. We had to use CMF because CMF was the chemotherapy regime that you could actually combine with radiation treatment. And then the patients were randomized to either synchronous or sequential therapy and followed up for 10 years. What we see is a significant reduction in local breast cancer recurrence in patients having the synchronous treatment. 2.3% reduction, that was statistically significant. This is equivalent to a 35% reduction in the risk of local recurrence. So a very large benefit, very similar to the benefits seen with chemoradiation in other sites.
Synchronous therapy appeals to patients for a variety of reasons.
Have we impacted on survival? Have we, by giving the synchronous treatment, have we made the chemotherapy less active? The answer is no. The survival rates are exactly the same. We're not compromising patient survival in any way by giving these treatments concurrently. And what about quality of life? Have we made their life miserable by giving the synchronous treatment compared to sequential? The answer again is no. There's no difference in quality of life between synchronous treatment and sequential treatment. The biggest benefit as far as the patients were concerned and why the trial was so popular and why it recruited beyond its target number, patients liked the fact that when they finished their last chemotherapy, they'd finished all their treatment. They didn't have to wait another 4 weeks to start their radiotherapy. It's a long haul for patients having adjuvant chemotherapy and radiotherapy. They like the fact that they finished their chemotherapy, they can book their holiday, they can get back to work. There are lots of benefits in that way too.
From the Combined European Cancer Congress in Stockholm, I'm Charles Bankhead, MedPage Today.